Namaskara. Ahara Arogya Adhyatma, the light of samskara. Welcome to the today's discussion with Dr. Parimala Devi, a renowned gynecologist, obstetrician, and a Guinness World Record holder. She is going to describe and teach us what is bleeding per vagina and how it is important for women. Welcome, Dr. Parimala Devi.
Namaskara, madam.
Please tell our viewers
Yes.
what is this
Yes.
bleeding per vagina, because every girl, the moment they attains the menarche till the menopause, she keeps bleeding every month. But what is this so special about the bleeding per vagina other than the monthly periods?
Yes. Very good morning to everybody here, and also special my pranams to our teacher, Madam Dr. Vijayalakshmi Balekundri. Madam, thank you very much for giving these opportunities where I can share my little knowledge with the people who are listening to us, especially the women. The today's topic, what you have asked me is like bleeding in women, excessive bleeding in women. Bleeding in women is common because once from 13 year or 12th year menarche, the first menstruation, till the 50, 51 year, the menopause, a girl and then a woman and a lady have to menstruate every month or at least 1.5 months. But what happens depending on the age, the bleeding which is supposed to happen every month or at least 40 days, something like that, it may happen in a very excessive way. For example, a girl of 14 years, she has just attained menarche. The mother will run and come to the doctor telling that, Madam, she is bleeding so heavily. I am unable to send her to the school. I am unable to take care of her because she is also a very small, still immature girl. She doesn't know about how to care about herself in the menstruation. These are all things which we will have to consider here. Especially in these girls, we call it as a puberty menorrhagia because that girl is in puberty, that
Okay.
12, 13, 14, 15 years. So
Yeah.
menorrhagia here, there is no reason or anything. It's all because of the coordination between the hypothalamus in the brain, pituitary and ovaries down in the whatever we say like uterus. All these have to correlate to one another, coordination we can say, and produce the hormone. Those hormones will act on the ovary and give rise to a good menstruation. But when
Okay.
the system itself is still developing, there can be a heavy surge of some hormones in that, especially the estrogen, the lady hormone. Then the time the girl may menstruate a little bit more frequently and more heavily. Other than like she may be having a little bit of excess weight. These days,
Okay.
the girls are also a little obese because of
Obese.
the
Yeah.
sedentary lifestyle, and they are not
And
doing
eating
any
junk
domestic
food and
this
various
one.
things. Yeah.
They are into the junk food habits and all. In your channel only about health and food, you are explaining so well. So because of that, there can be again some hormonal variation, more steroid produced because of the polycystic ovary. This is another thing.
Hmm.
Polycystic ovary people also, because of irregular period, or sometimes they will come with intractable continuous bleeding. It may not be
Okay.
heavy, but disturbing to their routine. So this
Okay.
age group, usually we will have that heavy bleeding or irregular bleeding, and we have to see that mother is educated about her food habits, because anemia
Okay.
can be one reason, because these girls are not eating properly the healthy food.
Okay.
They are more into junk food. So this category is to be treated accordingly, and there is no question of surgery or anything in these cases. But the
Ah.
important group, which is very important for a doctor who have to consider and treat, is the group which is in the reproductive period of their life, that is between 20 and 35 to 40 years. When a woman is
Okay.
into her sexual activity, she is into bearing pregnancies, delivery, and sometimes there
Hmm.
can be, without her carefulness, some abortion she may face. In all
Ah.
these things, there can be heavy bleeding which she may face, and because of her inability to attend to herself, because she have to care for
Okay.
the family, her child, she may become anemic also. Because of the
Yes.
anemia, some 20% of the women will start having heavy bleeding. So
Okay.
in and the another important thing is having fibroids in the uterus or
So you
ovarian
mean to
disease.
say,
Uh,
that the bleeding leads to anemia, anemia leads to bleeding. So it's a
Yes,
vicious
it's like a
cycle.
chick
It's
to
a
young,
vicious
egg to chick.
cycle.
That's
Yeah.
the yes,
Yeah.
vicious
Yeah.
cycle.
Cycle.
Unless we correct anemia, she will not be all right. But
Correct.
especially with there are tumors like structural problems like fibroid tumor, adenomyosis, that is a uterus growing bulky or something double the
Okay.
size of what it is, muscle hypertrophy. In
Hmm.
all these things, the bleeding will not be controlled. In fibroids
Okay.
and in these cases, adenomyosis, the menstruation surface will double up. The menstruation surface, which
Okay.
is supposed to be like this, when the uterus
Huh.
becomes double, naturally the surface will be heavy
Surface will
and
become
bleeding
more.
will not be controlled. And those fibroids may come and sit near the mouth of the uterus, that is called as polyp. And because of the
Okay.
polyp, it continuously vascular blood vessel supply, it will
Hmm.
continuously keep bleeding. So these are all
Bleeding.
very important thing for a woman because they definitely require a lot of examination, and ultrasonography has become a boon for us.
Hmm.
Ultrasonography to see whether she has fibroids or not. And another
Hmm.
important thing is we should not be missing thinking that it's a heavy bleeding because of some tumor, but there can be an incomplete abortion. We can speak
Abortion.
about
Okay.
pregnancy
Oh.
abortion and all in some other time, but many a
Okay.
times 10% these bleedings are mistaken for some tumor or something. But when we do the scanning, take a proper
Hmm.
history, like how you have taught us, like you should
Hmm.
take proper history of the patient, what they have done, what is their previous children, or any tablets
Hmm.
they have consumed. Because history of taking a proper history will diagnose at least some 60% of the disease you
Yes.
have taught
Yes.
us. So
Yes.
because of
Yes.
that, we will come to know it is a half done abortion also sometimes. To just to
Okay.
hide the abortion from the family, they might have taken their own abusing the drug medication, and then
Okay.
they might have ended up with a heavy bleeding. So these are all few
Okay.
important things. And another important thing is endometrial hyperplasia. That's what Madam also was telling about that. That is the menstruation layer will unnecessarily, because of the hormones, it will multiply the
Okay.
hyperplasia. Because of that, also there can be heavy bleeding. And sometimes, to for a family planning purpose, these women will be having UCD. That's copper T. Copper T
Hmm.
is one of the common contraception a woman follows for the spacing of the children. In between two
Okay.
children, she wants to space herself. Copper T
Okay.
has itself, for some people, may give some heavy bleeding. So these
Okay.
points are to be very much taken into consideration, and we
Consideration.
should treat them accordingly. Surgery is not the answer for all these conditions.
Correct. Correct.
They can be
Correct.
treated with just a small DNC also, or some medicines also. DNC is
Hmm.
a minor procedure, to come and go procedure. These days it is called office hysteroscopy, office DNC, like that. In the OPD
Okay.
only these things are done. The
Okay.
next age group is menopausal or perimenopausal age group, that is 40 plus, 45 plus. In this
Hmm.
age group, you have to be more attentive because there can be cancer related problems also. We cannot
Oh.
neglect them
Oh.
by telling, oh, everything is fine. You will give some tablets and send you.
Yeah. Yeah,
Because
sir.
whatever tablets you are giving for these reasons, for the menstruation or uterine reason, will have a
Hmm.
side effect on the breast also. And I
Okay.
think, madam, surely you are telling your patients that because breast cancer is the first cancer now, second is the uterine cervical cancer. So
Correct.
when such a
Correct.
condition is there, we have to very carefully monitor these people. Again, rule out any fibroid is there, any ovarian tumors are there. Hope there is no cancer element in these tumors. They may be benign. They may be simple tumors also. And because of
Okay.
the menopause, there is a intractable bleeding because the uterus is unable to control the bleeding, that is called as AUB or DUB,
Okay.
dysfunction
Okay.
uterine bleeding. That is about
Okay.
30% of the women come with that. And these
Oh.
days, it is obesity also has become an epidemic because of their
Correct.
sitting job, or sitting a lot of beautiful serials coming. Sitting 1 hour is equivalent to 15 cigarettes. Our beloved Dr.
Correct. Correct.
Manjunath
Correct.
Jaydev always says about it. So because of the sitting disease also, the woman can grow her bulky uterus, and she may end up with heavy bleeding, DUB and all. So in all
Hmm.
these conditions, we have to consider what drug will suit her, what we can do. Then scaring her is a hysterectomy is the answer. Hysterectomy is not at all an answer for
Answer.
any of
Correct.
the
Correct.
problems, most of the problems. So we
Correct.
have to see that we conservatively treat them, assure them. And as you tell in your important talks, Madam, Ahara, Adhyatma, those two things also should be incorporated. Then they can definitely lead a healthy life. But a heavy bleeding, whenever there is, immediately it should be required for the attention, and they should visit the doctor, then
Yes.
treating themselves over the counter drugs. That's very
Okay.
important. And we should
Yes.
not be missing any cancers in especially elderly
Correct.
women.
Correct. Correct.
And these are a few of the points. And other causes like pregnancy related, we can discuss with another
But later on,
epidemic,
in another
another episode.
episode.
Episode,
Okay.
sorry.
Okay. Okay.
Mhm.
Thank
Okay.
you very much, Dr. Parimala Devi.